Hello, today I will be presenting preliminary results from a series of retrospective mortality surveys done in April and May 2023 among displaced populations in camps around Goma in the DRC. So it's already been referred to a little bit, especially in the cholera session, but the Democratic Republic of Congo has long faced political instability, particularly in the east. Rapidly changing conflict dynamics in North Kivu, starting in 2022, have led to numerous waves of population displacement, with recent figures reporting around 700,000 displaced people in North Kivu in general, including around Goma. While not homogeneous, most camps have extremely poor living conditions, with lack of basic necessities, irregular food distributions. As NAS and the cholera session they already commented, cholera outbreaks have also occurred in several of the camps. Additionally, as many health runs across North Kivu have reported ongoing measles epidemics. So in response to the latter, measles vaccination campaigns with MSF support have taken place in several camps in recent months. MSF has also other ongoing activities, including response to the malnutrition and sexual violence that we observe in the camps. So in an effort to more fully understand, describe, and better respond to this situation, we have implemented a series of surveys in 3 different sites. So our study objectives were the following: to estimate the retrospective crude mortality rate for the total population, as well as for the under 5, as well as to have an idea, an indication of the major causes of death among the households in the sites. We also wanted to estimate the prevalence of acute malnutrition among children 6 to 59 months using MUAC, so middle upper arm circumference, and presence of edema. We also wanted to look, after these vaccination campaigns, the proportion of children 6 months to 9 years that were vaccinated against measles. And finally, we wanted to evaluate the frequency and type of violent events that were experienced among household members. So to do this, we carried out cross-sectional retrospective mortality surveys in the camps of Rusayo, Shabindu, and Don Bosco. Shelters were selected using geospatial sampling thanks to the support of the Manson unit. The survey included a questionnaire with the head of household and a nutrition screening with MUAC and edema for children 6 to 59 months present at the time of survey. The recall period in the mortality survey for our analysis was January 1st, 2023. To have an idea of the situation within the camps, we looked also at mortality since households had arrived at the camps. So in total, we included more than 2,000 individuals per site, ranging from around 400 households in Shabindu to a little more than 500 in Don Bosco. Here we present the population distribution by age category and sex among all included household members. In all 3 sites, we observed a prominent indent among males 20 to 24 years old in the population pyramid. We observed less males than females overall, and particularly among the men 15 to 29 years old in all of these sites. In Rusayo, more than half of the households arrived in February 2023, so the households had on average been in the sites for around 3 months. In Shabindu, arrivals were evenly split between February and March 2023, so they had an average, so households were on average in the sites for around 2 months. In Don Bosco, most of the household had arrived at the end of 2022, so October and November 2022, with an average stay of around 6 months in the sites, in the camps. So first, let's look at the mortality rates, the preliminary results that we have. So we observed high levels of crude mortality in both Rusayo and Shabindu at 1.5 and 2.1 deaths per 10,000 persons per day. Mortality rates among children less than 5 years old were also high. This high crude mortality rate is driven primarily by violence prior to the arrival among both of these populations. In Don Bosco, the crude and the under 5 mortality rate since January are both they're both much lower at 0.5 and 0.6. So now we look at the crude mortality rate stratified by sex. So in Rusayo, the mortality rate is elevated in men compared to women. This difference is explained primarily by the violent deaths that were almost entirely in Rusayo reported among the men compared to the women. In contrast, while similarly high levels of violence were reported in Shabindu, we don't find this difference in sex among the two. We find that there was quite a lot of violent deaths observed among both men and women. And finally, to look at the situation within the camps, we calculated the crude and under 5 mortality rates since the households arrived in the camp. So in each of the camps, they had slightly different arrival months in the camp. So we observed still high mortality rates in both Rusayo and Shabindu. So in Rusayo, this is hello. Okay, so in Rusayo, this is particularly evident among children under 5 years old with a mortality rate of 1.6. And this is driven by a combination of causes of death of diarrhea, measles, fever, respiratory infection. In Shabindu, in contrast, the crude mortality rate was high at 0.9, with diarrheal deaths reported as the most frequent, mostly among people older than 5 years old, which would make sense in the context of cholera epidemics in several camps. In Don Bosco, the mortality rate is similar to what was observed for the entire recall period, which is logical considering that most of the households had already arrived in the sites in 2022. So now here we'll look at the SAM and the GAM prevalence by site. So in line with what we observed with mortality, we observe malnutrition prevalence elevated in both Rusayo and Shabindu camps compared to Don Bosco, including a SAM prevalence bordering the emergency threshold at 3% in both of the camps. So now let's look at the vaccination coverage after recent campaigns in Rusayo in March, and Shabindu and Don Bosco more recently in April that targeted children 6 months to 9 years. We observed overall measles vaccination coverage of 80% in Rusayo and more than 95% in both Shabindu and Don Bosco, the latter two which reached then herd immunity threshold. What am I even on? Okay. Too many things going on with my hands right now. So finally we look at violence reported among the households. So between 4 and 5% of household members reported a violent event across the 3 sites. We can see that the most frequently reported violent events were sexual violence, confirmed as rape in this case, beating, and psychological violent events. More than 40% of the violent episodes were sexual in nature in Rusayo, and more than half in Don Bosco. So if we look a little bit further into the cases of rape reported, here we present the proportion of women that reported a rape by age group. We observed that approximately 10% of young women in Rusayo and Don Bosco reported a rape in our recall period. Similarly, high prevalence was observed in the sites among older women. In Rusayo, more than half occurred in the vicinity of the camp, while in Don Bosco, they occurred most frequently while in transit to the site, as well as in the vicinity of the camp. So our conclusions are the following. We found high mortality rates in 2 of the 3 sites, with most deaths linked to violence prior to arrival in the camp. Nevertheless, the mortality rates remained high after arrival in the sites. The lower level of violence observed in Don Bosco is likely related to the recall period, as they had arrived mainly before in 2022, so we didn't collect or we didn't present these deaths here, but not to say that they didn't have this also. The malnutrition prevalence was elevated particularly in Shabindu and Rusayo, and while the sample of children was small, this should be considered together with other nutrition data that we have available in the area, as well as the measles situation, the irregular food distributions we know about, and other aggravating factors. Although it's largely based on verbal recall, we observed a generally high measles vaccination coverage soon after a series of vaccination campaigns. The lower coverage in Rusayo, which was vaccinated earlier on, is likely linked in part to the population movement within the camps. And lastly, we observed high levels of violence, particularly rape, which is in line with the alarming numbers of sexual violence cases observed in MSF clinics. And this study would not have been possible without the hard work and dedication of the study teams in the field, the support of the MSF team in Goma and Paris, and the GIS support we received for the mapping of the shelters. We thank the Ministry of Health and the camp authorities for approval and support during the implementation. And lastly, we are thankful to the study participants for their time, participation, and willingness to share their experiences with us. Thank you for your attention.